My name is Dr. Zulia Frost, and I am a co-founder of Recharge Health and a clinical director. Near-infrared light therapy holds significant promise for the future of medicine. Its non-invasive nature and demonstrated safety profile makes it an attractive option for various medical applications. Today, I would like to introduce you to the FlexBeam, a near-infrared light therapy device which is designed to optimize physical performance, enhance muscular recovery, and accelerate injury healing. Additionally, the FlexBeam offers benefits such as circadian rhythm correction, improved sleep, and increased energy levels. In scientific papers, near-infrared light therapy is referred as photobiomodulation, an umbrella term, where low-intensity light produces cellular biostimulation. It is also known as red light therapy. One of the key advantages of near-infrared light is ability to penetrate deep into tissues, reaching areas that are otherwise challenging to access. This makes it particularly valuable for conditions like skeletal muscular pain, inflammation, wound, and tissue healing. The electromagnetic spectrum represented on the left shows a small portion of visible light, where red light transitions into near-infrared light. Red light is visible and near-infrared light is invisible to the human eye. Light absorption in mitochondria occurs within the narrow so-called optical window between 600 to 1100 nanometers, which is optimal for photonic absorption that activates mitochondria. Specifically, the best absorption in the red spectrum is 635 to 700 nanometers, and in the near-infrared spectrum, it is 760 to 1100 nanometers. Cytochrome C oxidase, in its oxidized form, is the chromophore that absorbs light in the range between 570 to 850 nanometers. FlexBeam operates within the range of 625 to 635 nanometers in red and between 810 to 830 in the near-infrared spectrum, as illustrated on the diagram below. There are wavelengths effectively stimulate mitochondria without causing thermal effect. In contrast, mid-range and far range of the infrared light is primarily absorbed by water molecules in the body, leading to a thermal effect, which is utilized in infrared saunas. However, thermal stimulation can increase inflammation. In summary, red light therapy uses photostimulative effect rather than thermal effect. And this approach not only avoids fueling inflammation, but actually helps to resolve it. Decades of research have provided valuable insight into the mechanism, optimal parameters, and clinical efficacy of near-infrared light therapy. A paper by leading researchers Lucas De Freitas and Michael Hamblin describes key mechanisms. Number one, photons dissociate inhibitory nitric oxide from the enzyme, increasing electron transport, mitochondrial membrane potential, and ATP production. In addition, light-sensitive ion channels activate, allowing calcium to enter the cell. This triggers signaling pathways via reactive oxygen species, cyclic AMP, nitric oxide, and ion of calcium, leading to activation of transcription factors. The transcription factors increase the expression of genes related to protein synthesis, cell migration, proliferation, and antioxidant enzymes. Also, light activates stem cells and progenitor cells. A paper by Kevin Cheng reveals the mechanism behind pain relief, including ATP production, increased intracellular calcium level, mitochondrial membrane permeability, reactive oxygen species generation, and vasodilation. Activation also of the peripheral opioid receptors and LED-induced analgesia through downregulation of nitric oxide. Increasing expression of tumor necrosis factor alpha, interleukin 1b, and hypoxia-inducive factor 1a. increased level of anti-inflammatory interleukin-10, and enhanced catalase and SOD enzyme eliciting antioxidant properties. Latest research links melatonin, a powerful antioxidant and a hormone that protects mitochondria, engages in DNA repair, regulates circadian rhythm, thereby inducing sleep, with red and near-infrared light therapy. These wavelengths stimulate the release of melatonin, as demonstrated in randomized controlled trials by many researchers, including Zhao, on the basketball players. Interesting research by Zimmerman and Reiter in the study titled Melatonin and the Optics of the Human Body, as well as by Igor Kvetnoy in the Melatonin as a cornerstone of neuroimmune endocrinology. They discovered that apart from regular processing of light photons by optical pathways, cells exposed to near-infrared light produce subcellular melatonin in mitochondria. This melatonin does not link and fluctuate with the biological clock, but is instead consumed locally in response to free radical density. Given the potent antioxidant properties of melatonin, this finding is crucial for understanding the mechanism and applications of near-infrared light and in preventing cellular damage. I'm sharing in the last paper called Melatonin, a mitochondrial resident with diverse skill set by Reiter, which states that melatonin enhances mitochondrial transfer through tunneling nanotubes. This is at least partially explains the beneficial effects of using light and potentiate the body and support the healing. Near-infrared light is well researched in the fields of sports medicine and recovery. Here I put together some key research papers concerning sport performance optimization and some studies that research most important biomarkers. Overall, you could see that all research papers found increased and improved these parameters: number of repetitions until exhaustion, time until exhaustion, peak force, peak power performance, maximum voluntary contraction, 1 repetition test, maximum test, electrical muscular activity, and VO2 kinetics. And also, the research demonstrated that the key biochemical markers reduced after using infrared light. So, the biomarker for prevention of muscular fatigue, lactate dehydrogenase, reduced inactivity, and also reduced blood lactate levels. Biomarker for inflammation, C-reactive protein levels also reduced, and as well as prevention of muscular fatigue or muscular damage, creatinine kinase also was reduced. So have a look at these links. I linked the key studies, which I'm sure you'll find it very interesting. Since the discovery of lasers in 1960s, where lasers were dominating the market, yes, low-level laser light therapy has evolved significantly with the adoption of LEDs, which offers advantages such as improved safety, affordability, and accessibility. Unlike lasers, which requires different safety classes, LEDs are inherently safe. LEDs can deliver specific wavelengths in modern time, including near-infrared, which with better precision and less heat, making them suitable for therapeutic purposes and home-based treatments. Both LEDs and lasers promote similar biological effects dependent on wavelengths and dose. This research by Abreu Chavez, 2014. Recent research shows that non-coherent light sources like LEDs are just as efficient as lasers in promoting photobiomodulation. This is a paper by De Freitas and Hamblin, 2018. Lasers deliver energy deeply and with precision due to their collimated, monochromatic, and coherent beams. LEDs, whilst covering a wider area with less risk of burns, require significant power density for deep penetration. But we'll get back to this very important point later. Now let's look at the impact from near-infrared light. So, as defined by one of the main researchers, Juanita Anders, in the summary, photobiomodulation have beneficial therapeutic effects such as alleviation of pain, reduction of inflammation, immunomodulation, and promotion of wound healing and tissue regeneration. It affects positively angiogenesis, it improves vasodilation, better quantity and quality of collagen production, repair of the muscles, bones, cartilage, and nerve regeneration. It also reduces inflammation and improves the immune function. Now, let's look how can FlexBeam enhance the recovery. FlexBeam is a wearable near-infrared light therapy device. This 3-module plus 1 battery are connected with a flexible silicone belt, allow the device to be flexibly wrapped around the joints. The device comprises of 6 near-infrared LEDs in the range of 810 to 830 nanometers and 3 LEDs at the range of 625 to 635 nanometers. When in contact, it irradiates in total of approximately 81 square centimeters. The key technical parameters of FlexBeam were calculated with consideration of fluence, dose of energy, and biphasic dose response. When in contact with the skin, FlexBeam has maximum output power as 100 mV per centimeter square in near-infrared and 50 mV per centimeter square in red. The device operates in pulsing mode and pulsing between 10 to 1000 Hz with duty cycle between 10 to 100 in 10 minutes treatment time. FlexBeam is intended to be used directly on the skin, anywhere in the body. It's an over-the-counter device and intended for temporary relief of minor muscle and joint pain, arthritis, muscular spasm. It relieves this all by increasing local blood circulation and emits non-coherent light, which affects accomplished through the optimization of mitochondria functioning and increase in mitochondria microcirculation stimulated by this light. Additional associated benefits are faster recovery rate from physical performance, increased energy level, and improved general well-being and sleep. Here, I would like specifically to explain what is special about the FlexBeam. The most important difference with other red light therapy devices on the market is power. These LEDs create high power density or high power irradiance. For LED technology, this is the key because compared to lasers, light is non-coherent, so it scatters a lot more. This potent dose guaranteed a deep penetration and complete safety of powerful stimulation without danger of burns. And because it's used directly on the skin over the injury, it reaches target tissue within the minimum loss of energy. Plus, if you bend around the joint, it delivers to target tissue light 3-dimensionally. It has also sweeping waveforms, frequencies, profile, modulated program. It is safe compared to laser. It's very easy to use and wrap around curves and joints. It's portable, you can be used anywhere, anytime, and it's affordable. FlexBeam can affect injury healing positively. It can be used at every stage of healing. Injury starts with inflammation, which is highly energy demanding. So, this near-infrared light enhances local circulation, nitric oxide, electron transport, stimulation of mitochondrial respiration, and ATP production. Increased mitochondrial membrane potential resulting in tangible energy. So galvanotaxis leads to active healing at the cellular level, and active angiogenesis contributes to faster healing. During the second stage, repair, or stage of proliferation, where there is an integration of damaged tissue and scar formation, near-infrared light activates stem precursor cells, satellite cells, and enables cellular proliferation, increasing collagen production and decreasing collagen degradation, and proliferation of fibroblasts, also faster conversion from fragile collagen 3 to very elastic collagen 1. And in the last stage, which lasts for a long time, remodeling, it involves production of fibroblast or myoblast or osteoblast, depending on the damaged tissue, which is designed to fuse and form new functional tissue and contract and reorganize scars. So generally speaking, photobiomodulation red light therapy is really well known for remodeling scar tissue faster, and also for nerve regeneration as well. So both diagrams, they on the right, represents faster healing with FlexBeam and with less pain and less inflammation. So what are the programs in the device? There are 3 programs. Program 1, designed for superficial skin issues, and mostly there will be red lights. And program 2, it's kind of mixture of both, program 1 and 2, and it's it's also delivered with the pulse mode, so it could be good for smaller joints or very superficial tissues. And program 3 is the one which we use the most. It's very deep, like deep sciatica, deep knee pain and joint. So it designed to penetrate deep because it's primarily near-infrared spectrum of light. FlexBeam is very safe, and in case of overdoing or overtreating, nothing can bad happen. So worst can happen is you don't get the result. In photobiomodulation, it is known as biphasic dose response. Basically, when it's too much of stimulation, the effects start diminishing. That is why it's important to make occasional breaks. It is recommended to use in clinical settings for 3 to 4 placements each time 10 minutes in combination with other modality. It's more time efficient to use 2 FlexBeams together at once. For acute conditions, until the injury is resolved, you can use it twice a day, or if you have it, your own device. For chronic conditions, you can use 3 to 4 weeks, and then you need to make a break. And then if symptoms persist, you have to continue to using it in a chunk of 3-4 weeks. When the athlete or patient uses FlexBeam in between visits, he or she can use it in case of acute injury 2-3 times a day and 1 or 2 cycles only in the first week of joint injury, and then you start doing just once a day. In case of a chronic injury, it should be applied at the area of injury, but plus, because there is an impact on body mechanics, on associated muscles and spine, and that would guarantee you a good result. When use FlexBeam, follow this 3 simple principles for placement of FlexBeam when you are dealing with an injury. So straight away, where it hurts. In addition, you can, if it's especially chronic injury, you can apply it to the corresponding part of the spine. For example, for the arms will be neck, for the leg will be lumbosacral, and use adjacent muscles. So I'm giving you this example, rotator cuff injury. First session, you can use protocol A, which consists, you could see, of 4 placements, each time 10 minutes. So basically it aimed at irradiating shoulder and the muscles around. For the next day, use next session or next, whenever you see the patient, use protocol B, because it includes the neck. And they are linked in case of rotator cuff injury. So often results from subluxation of C3, C4, C5, and consequent compression of the corresponding nerve and blood vessels. So targeting and relaxing muscles on the neck will help to reduce that compression. So follow-up sessions, you go back to protocol A, and then protocol B, you alternate this, and so on. So program and cycles are like indicated in these slides, and there are also frequency of use. So at the bottom, I'm quoting a scientific paper which related to tendinopathies. Also, you can use it for physical performance optimization. So approximately an hour before the physical activity, FlexBeam should be applied to the major muscles that will be engaged the most. Here would be a good idea to use both devices on symmetrical parts of the muscles. You can use them whilst the athletes perform physical warm-up exercises. In the same way, you can use it afterwards for combating fatigue and improving efficiency in sport. Here I'm sharing with the link which leads you to the special support website, which holds lots of useful protocols. And also we have a membership program where you've got free membership where we're sharing these protocols, and then specialized also protocols for specific conditions. We've got a very good support for you, so you can always get an idea how to best use your FlexBeam device. Now let's look at FlexBeam case studies. This effect on pain, on sleep, on testosterone, and performance optimization. The initial data was collected in clinical settings to study the clinical efficacy of FlexBeam on pain relief, following the regime 3 sessions a week for 3 weeks, followed by 1 week break. Further data was collected case by case in home settings, mimicking the home use of FlexBeam, using one of 2 regimes, 1 or 2 sessions a day, first 2 weeks with weekends off, followed by every other day during the 3rd week, and there was a 1 week break. As 1 session a day, every other day for 3 weeks, followed by 1 week break. So total of 50 data entries on pain score using visual analogs score of pain between 0 to 10 maximum, before and after using FlexBeam. Acute and chronic and even neuropathic cases were evaluated, basically anyone with pain. Acute pain patients receive 1 or 2 sessions a day for 20-30 minutes, and chronic 1 time a day, 30-40 minutes. Overall, there was a high satisfaction score. In average, pain presented as before on the diagram on the right in red. Score was 596 before intervention, and it dropped down to 152 within a specified period. And the graphical representation demonstrates 75% improvement in pain score, which is really high. The second case study is effects on sleep. There was a male 34 years old with over 8 years of chronic insomnia. He did not attribute to seasonal affective disorder. He was feeling exhaustion, drowsiness, foggy mind, headaches, heart palpitations, and melatonin, as you know, is a powerful antioxidant protecting mitochondria, regulating biological clock, was chosen as a specific biomarker for circadian rhythm. So FlexBeam used in 3 places for total 30 minutes, daily for 5 days with 2 days off, and total of 4 weeks, and afterwards was a week break. And of course the test was immediately before and exactly at 5 weeks after. So result, you could see if it was before, melatonin levels in the morning was out of the range and very low at night. It literally regulated, self-regulated to back to green, the normal range. So ineffectively, the patient reported much better sleep, waking up fresh in the morning. 9 months later, he still reports normal sleep pattern without any further intervention. Now another study on sleep, male 59 years old with poor deep sleep pattern that was affecting his physical and mental performance, and he felt fatigued. Overall, sleep was regular, but she consistently, when falling asleep, it was approximately 8 hours 39 minutes, and data collected with Oura Ring. So FlexBeam used in 2 places over the stomach in program 2 and daily for 1 week, but then he was only using just one position over the heart vertical and used program 3. And so what happened, he was using it before going to bed. After a total of 8 weeks with no treatment break, he got the result, improvement in deep sleep pattern. But we also tried to include some placebo effect. So basically the LEDs were taped and no active stimulation received in a very short period of time. So we could see on Oura Ring how his sleep behaved. So the highest ever recorded deep sleep was after first day of using FlexBeam. So we have this 12 months baseline and then 2 months of using FlexBeam. So if before it was 39 minutes of deep sleep on regular average basis, with FlexBeam on average basis increased by 51 minutes. So this constitutes for 31% increase in length of deep sleep. So that was a desired effect. Effects on testosterone. A hormonal decline affects both men and women. In women, it is always often associated with osteoporosis, and both sexes have muscular waste and reduced libido as a result. Any hormone replacement therapy has a potential risk, and overdosing or also could have some side effects. So near-infrared light has no side effects and it's safe to use. A 46 years old male volunteered to evaluate FlexBeam for testosterone level. So he used it every morning, daily, following specific protocol with 3-4 placements. So testosterone levels were assessed at the baseline, then 4 weeks, 7 weeks, 16 weeks after. And the results demonstrated an increase in bioavailable testosterone, huge, by 48% after continuing for six weeks of use. And after that, he used intermittently. However, the results was sustained during the next 4 to 6 months. So there is a hope. Another case study was for evaluating the impact on physical performance. A randomized, double-blind, placebo-controlled ongoing study was designed to assess FlexBeam effect on muscular endurance and recovery from fatigue after physical exercises. Results were quite remarkable. Across all active groups and time sets, there was a notable average increase in exercise sets until complete fatigue compared to baseline, so between 21 to 33%. This pilot study will be presented at the Therapy Expo, and I look forward to present.